My name is Bob Kley. I'm currently the Vice President and Chief Operating Officer of the Mental Health Association. And I had the privilege of being involved with Monarch when it first started back in really the late 80s as it began as a concept coming out of the Mental Health Association in New Jersey. The Mental Health Association, which is right now a 62-year-old advocacy organization focusing on the needs of individuals with mental illness in New Jersey, had identified the housing needs of folks with mental illness in the late 80s as being one of the major issues facing the state of New Jersey as deinstitutionalization continued to happen, as the state looked towards closing more state hospitals and facilities. The real housing crunch of trying to find affordable housing for individuals with mental illness became a major issue. It developed in our public policy committees with a lot of research, really led by one of our chief public policy individuals, Gail Levinson, who really kind of brought the idea of starting a housing development corporation as a proactive idea, concept to address the issues of the policy issues of housing and making it into reality. So the Mental Health Association and its board of directors established a committee to investigate this aspect, look for funding opportunities, and established Monarch Housing Associates as the vehicle to really start to concretely address housing needs for individuals with mental illness in New Jersey. I had the opportunity, being appointed by the board of directors, to serve as the first president of Monarch Housing Associates, and we did a statewide search and identified Richard Brown to be our first executive director, and we began the process. We started to develop relationships with housing organizations like the New Jersey Department of Community Affairs. We started to look at the housing community. We started to look at opportunities that we can recruit people with expertise in housing to the Monarch Board of Directors, looking to identify what kind of resources we could bring into the state of New Jersey to help folks find housing and for us to develop affordable housing for individuals with mental illness in New Jersey. Some of our first initiatives is really looking at and identifying what kind of models that would be effective. And really, it's the supported housing model that today is throughout the state of New Jersey. In the early 90s, that was one of the beginning missions really of Monarch, is to develop and talk about the idea of permanent supported housing as an opportunity for folks with mental illness. Supported housing was really not an idea. I think through the work of Monarch, I can remember many times Richard and I going out all over the state talking to family groups, consumer groups, trying to develop the idea that there's an opportunity for folks to have permanent housing, that's a real option. We worked initially with collaborative support programs in New Jersey, working on and developing the supported housing model. In the 90s, we developed a very unique partnership with collaborative support programs in New Jersey, being called CSP, being the major consumer organization, again wanted to partner with us in developing the concept of housing for consumers, new options, new opportunities. And through that partnership, we submitted and developed and acquired the first 811 housing for the state of New Jersey. That became kind of the foundation for additional work that we began to do in the early 90s, and the foundation that we build expanding partners to be involved in housing. I think one of Monarch's greatest achievements is to expand the opportunity of different organizations to see themselves as providers of housing. Richard and I did many road shows in the early 90s, visiting family groups, consumer groups, mental health boards, agencies throughout the state, talking about the concept that local organizations have a responsibility and the opportunity to develop housing for folks with mental illness in their community. That housing is part of the permanent structure of a community, the permanent needs of individuals that foster recovery and wellness. And residential services do not have to be programs. They can really be permanent, affordable housing. And I think that commitment over the last now 20 years has developed housing for well over 3,000 people. And if you look at, I think, New Jersey, when it comes to our consumer movement, about the focus of how effective I think the state has begun to becoming driving the transformation to wellness and recovery, one of the major driving forces behind that has really been the development of the supported housing model, in the early 90s. That really helped drive the consumer movement, and I think that's one of the legacies I think that Monarch will always have. It was one of the key driving forces to keep transformation happening, keep change happening, bringing new people into the system of change. Again, housing has always been one of the critical issues facing, and still today is one of the critical issues facing someone who's in the process of recovery from a mental illness. I think one of the years that I always remember from my experience with Monarch Housing was in 1994. That really became the culmination of a lot of the groundwork that we did over the first number of years, our road trips around the state. We applied for and I received, I think, 17 Section 811 housing projects that year. That's a tremendous amount of money and resources coming in for supported housing in New Jersey, and I think that was really one of the key moments that we had. We had some great partners, the people, our friends from Project Live, the Mercer Alliance for the Mentally Ill, Triple C and Mercer in Middlesex County, and the collaborative support programs. Again, we put together these wonderful applications, and I think it demonstrated to the state, to the Department of Human Services, and I think even to the governor's office as we move forward, that supported housing was something to be reckoned with, and it was recognized by the federal government as a way that we can really move our housing stock for folks with mental illness. I think then as we moved towards the mid-90s, I think as the supported housing movement really started to gain a foothold in New Jersey, one of the things that Monarch was involved in starting was the beginning of the Supported Housing Association in New Jersey, which is really exciting as our partners kind of came together to start a really grassroots organization to expand supported housing. And that led very excitingly to the Corporation for Supported Housing, the national organization, to come into New Jersey, to put the resources into the state of New Jersey to allow us to continue to expand and bring new financial resources to the state,